Hey, for fuck's sake, it's Dr. Cari back today. So I don't know if you caught my recording with India Johnson, but she is a clinical sex therapist down in Phoenix area, and she recommended that I speak to her buddy, Holly Nelson, and she's here with the Connection Couch. And so we get to talk to her today and see what her take on things are from her perspective. So she is a licensed professional counselor with a master's of science in clinical mental health counseling. She's also going for her sex therapy skills training currently. And she's been working in the Scottsdale, Arizona, and Utah area for the last 5 years with her patient population. She is sex positive, queer, and kink affirming. She celebrates and welcomes diversity and erotic expression, sexual lifestyle, gender, and neurodivergence. And she does a lot of things as far as EMDR, which we've talked about on this show, and has completed advanced EFT trainings. So that is Holly. She is full of all of the fun acronyms and lots of good experience in the Southwest area. Welcome, Holly.
Hey, thanks for having me. I'm excited to be here.
Yay. Have you done a podcast before?
I have. Yes. I've done quite a few. So
nice. What do you like to talk about?
All things sex and sexual health.
What do you think are some of the major things that come through your telehealth door?
Yeah. So I work with a lot of performance anxiety in men, sexual trauma, sexual pain, and then lots of relationship. So like libido discrepancies, if there is pain, the issues that it can cause in the relationship, performance anxiety, how that impacts the relationship as well. Mm-hmm. So a lot.
I have expressed a bunch of different times in my personal and professional life that I hate the term performance because it sounds like it's a job. Performative doesn't sound sexy or fun or playful. It seems to put the penis owner on the spot as far as like whether or not they're getting the job done.
Right.
How do you feel about that? Am I just being too sensitive?
Yeah, no, I agree. I think it completely takes the fun out of really any experience, and it, can show up as like really inauthentic.
Yeah. How do we change the verbiage about that at least? Because I feel like that would help change the perspective and mindset that penis owners go into it with. Like this should be fun and pleasurable and joyful. And like if you're performing, that feels heavy.
Yeah, certainly adds a lot of pressure. I think you said it perfectly. Like we need to shift the focus from like performance and outcome, because a lot of people are focused on like the orgasm, and focus on pleasure and connection instead. Creates a completely different experience.
It's funny because people talk about, that we've gone too far into political correctness with vocabulary and phrasing and stuff like that. But I do feel like in instances like this, it's important to acknowledge that we're not like this vocabulary doesn't really work, and it probably makes things worse for people.
Absolutely. Yeah. And when most people are getting, their sex education from media or porn, it spreads a lot of misinformation and people get the wrong ideas. And that's where all these problems stem from.
Right? Like, I don't look like that. I don't sound like that. I don't act like that. I can't do those things. Like,
I should be able to last this long. Right? Yes.
Oh my gosh. Yeah, I think, you're making a potentially dicey situation even more fraught with peril. Like it's never going to work out because you already have in your head something that isn't really real anyways.
Yeah, absolutely. Because porn in the media, they don't teach you, what intimacy looks like with a real person, that there's going to be, awkward moments, that there's cleanup, that, sometimes people have pain, or, erections will wax and wane, and that's completely normal. It sets all of these unrealistic expectations for a sexual experience, if that's where you're getting your information from.
Mm-hmm. So what else are some of the, therapeutics or advice or even perspective that you give to your patients on that?
Yeah,
with performance issues.
Yeah, I think if you notice that, you're worrying about sex beforehand, that's a good indicator that, your ED is psychological, not physical. And I think in those moments when you are being intimate with a partner or partners, if you notice your mind is wandering, which is normal because brains will do that. They like stimulation and they'll move around. But just bringing your focus back to sensation in your body. It's the best way to bring yourself back to the present moment.
Yeah. So, but, some people might think, well, you're just being selfish because you're just thinking about your own pleasure and your own sensations and your own self in that moment.
Mm-hmm, mm-hmm. Well, I think, having good sex requires us to be a little bit selfish. We have to know what we like, what feels good, and then, have that safety within a relationship to know that if something doesn't feel good, that we can speak that up and speak about it, and it will be respected.
Yeah, that's so huge. I speak so much about communication and how, like, in my previous vanilla monogamy life, that was not a focus at all. And I was as loudmouthed as I am, I never talked about what I liked or disliked, or especially in the moment. Yeah. I wouldn't be like, oh, to the left, or, that's too hard, or anything like that. Because I don't think that's necessarily appreciated.
Right. Especially when it comes to like heterosexual women, vulva owners, we're also really not taught about, our own anatomy or our own pleasure. And so it makes it difficult for us to express and communicate that in the moment.
Yeah, it's really, I still struggle with it now. I'm better than I used to be. And I'm really good about talking about it beforehand or afterwards. Mm-hmm. So yes. Exit interviews and stuff like that. Like, what did you like and what was great and what could have gone better? And I never did that
but
before.
Those types of things should be normalized. Yeah, like people don't know how to navigate those conversations. And when you're first being intimate or sexual with a new partner, you do have to have those conversations of what do you like? What don't you like? What are you not okay with? Like, what are your hard stops? And those are oftentimes conversations that are never had.
Yeah, I think, and porn isn't going to do that.
No.
Your parents aren't going to do that. Your friends and family probably aren't going to talk to you about that. Like, it's so interesting. Like, where do you get that even before you hit the therapist's office? Because by the time they get to you, like, they've obviously been having issues for a while, and their own, working on themselves hasn't been successful enough. So, like, where do you get that education from?
Trial and error. You don't. You don't in this country. You have to be intentional and, proactive about seeking it out yourself. And when you're a teenager or a young adult, you're likely not going to do that. Right.
And especially if you're keeping within your peer group, your age group, you're all just kind of flailing around with the same lack of information, essentially.
Right.
Yeah. So that's where cougars come in. No, I'm just kidding. No.
Yes.
Oh my God. So often I talk to Men who are so young, like people that I'm not going to mess around with. But I so frequently ask them, like, did someone's mom or aunt come at you? Like, why are you 23 and talking to me like this? This conversation is going to end soon, but I'm just curious.
Silver tongues. Yeah.
What
The
is
confidence,
happening?
I guess.
I know.
Confidence will take you far.
Only with a brief conversation with me, but I just think it's so interesting with that.
Do you get that a lot? Like,
oh yeah.
The more younger guys are starting to like throw themselves at you.
Yeah, but I'm just
I look forward to that. Just ego boost.
There is a little bit of that, you look so great for your age, and I'm like, I just look great. Stop it.
Yes, stop it.
But yeah, I think just my curiosity about human psychology in general, like I almost always, if they're respectful and they're, not being disgusting, I will kind of creep up on it. Like, why in the world would you be contacting a woman in their 50s? Like, you should be hanging out with my son, not with me. And because I kind of want to know the background story.
Right.
And usually they're like, oh, I've just always had a thing for older women. I'm like, that's not helpful. Like, I need something more specific than that. But I don't think most of them don't have it. They don't know
that insight. Yes, exactly. I mean, it is a common, kink fetish.
Mm-hmm. Yeah, and I can't reciprocate that.
I think people like, variety, truthfulness. Mm-hmm. Not even if they technically, want to act on it, they just like the idea, the fantasy of whatever it is in their head.
Yeah, I can absolutely see that.
Mm-hmm.
So are you mostly working with couples or individual patients?
I see about 50-50. Okay. Yeah. Uh-huh.
All right.
A lot of the individuals that I see have sexual trauma. And so are just trying to navigate reconnection and safety within their own body. And then the couple
been assaulted in the past.
Yeah, whether it's like childhood or, happened in their adult years. Sometimes the interesting part is that the people that I work with who experience childhood sexual abuse and then sexual trauma later as an adult have an easier time addressing it than, a survivor who just experienced sexual trauma in their adult years. Those survivors often don't address their sexual trauma until years later.
Do you think, is that denial or just blocking it out, or where do you think that comes from?
Yeah, I think because childhood sexual abuse survivors are just desensitized to it. It's kind of sadly, tragically been a normal part of their experience. And so it doesn't trigger them the same way as, an adult who's experienced, sexual violence.
I am just fascinated by this because you're describing me totally.
Really? Mm-hmm.
Yeah. So I was abused as a kid, and never, there was no outcome from that. It just went away, as usually it does. The family just sweeps it under the rug, right? And then I didn't even identify date rape as what it was. Like, I made it into this, I think he really likes me and blah, blah, blah. And that totally is not what happened at all. And then since then, when people have gone over the line, when people have touched me without consent and things like that, I am very blasé about it. And I think the main reason why I call attention to it at all is because I'm worried about other people being assaulted by that person. And like, if I just blow it off, like, it doesn't bother me. I can just blow it off. But I'm like, ugh, if he would have done that to a bunch of different women who are not blasé about it, they're going to be traumatized. And so that's actually my driving impetus to call attention to the fact that they're dangerous people.
Wow. Not even, first off, I'm sorry that happened to you, you know, the multiple different occasions. And yeah, it's just heartbreaking that's
so interesting.
Yeah. And I think so often we have more compassion, empathy, like firmer boundaries for, you know, what we believe other people deserve versus ourselves. And, you know, it's really quite sad because I don't think we're taught to, you know, love ourselves or stand up for ourselves the same way that we would someone else.
Yeah, that's so interesting. Like, I was not turning this, I'll send you some money. I was not turning this into my own therapy session.
Now billing you for this conversation.
Exactly. Like, you know where to find me. But I'm like, wait, what? Oh, that's totally in my head. Why would that be? Yeah, that's so interesting.
And it's the same for every person that I talk to in my office. We're so much more empathetic and compassionate for others. When it comes to ourselves, for some reason, we all feel so undeserving.
That is not, I hope, like, I don't know, as parental things are changing, maybe those messages will also change. You know, you don't want your kid to be an entitled asshole, but you also want them to value themselves.
Right. Yes. And know that, you know, if you believe your friend or partner or, you know, family member is deserving of this, that you are as well.
Interesting. So do you have a lot of survivors that come to you with complaining of sexual pain with sex?
Yes. Yeah. Sometimes it is related to a sexual trauma, and other times, you know, it could just be from birth, like giving birth, like birth trauma, because that's, you know, extremely traumatic to the pelvic floor.
Yeah.
And that's another blind spot that women vulva owners have. You know, up until recently, I'd never even heard of people, certainly not with my mom, like preparing to give birth, you know, through pelvic floor therapy beforehand, much less after.
Right. Yeah. India also talked about the results of religious trauma, and then, you know, you are virginal and you get married early and you have like all of these preconceived, frankly, brainwashed notions about how it's all going to go and how it's going to feel, but nobody's really talking about the reality of anything.
Right.
And then your pelvis is like, nope, we don't do this. Like, we've never done this. And then they're,
and it's shameful. It's bad.
Shame and pain. And now I have even more shame because I'm not able to perform my wifely duties. And then right. And then you just get into this whole cycle of, you know, you're not even looking forward to it. Like, oh my God, is this guy going to touch me again? Please say no.
Yeah. It's a cycle of like, okay, it hurt the last time I experienced penetration, and now the penis is approaching and I'm already worried, anticipating the pain. And so my body is clenching and tightening up, and that just reinforces that cycle.
Right. So
and again,
how do you do? I mean, because people may or may not know that you can get like a dilator set, you know, or, you know, lots of fun lubes and things like that to try to, but that's really hard when you've been brought up in a culture where you're not supposed to touch yourself. Right. And now you're actually supposed to be performing your own pelvic therapy on yourself.
Right. Yeah. And I think that's, you know, one of the most important things to remember if you're experiencing pelvic pain or, you know, vaginismus, that it's not just physical, it's psychological. Do you need to address the physical cause of it, yes, 100%. Or it goes hand in hand, it works together. So my recommendation for anybody experiencing painful sex is skip the doctors and go and see a pelvic floor therapist. Get an exam done. They will be able to tell you more so what is going on than a urologist, than an OBGYN or gynecologist will. And then dilators, 100%. You start with the smallest and then work up. And then all the while on my end, we're working through like, what are the negative beliefs about yourself around being a sexual being, and where do those come from?
That's so much to unravel, especially, what would you say the average age of your patients is?
I would say I see more like millennials, so like 30s to like mid 50s.
Yeah, people so young, and you're thinking like, that's the time of life you would think, oh, everybody's just like fucking like bunnies and it's easy peasy and so natural, and and it's so sad because by the time they get to you, Holly, like they've been struggling for a super long time and may have never been successful with their sex lives, right?
Right.
So,
right. And then you've got like, most of them are married. And if we're talking about women or vulva owners, there can be this cycle of like, they feel pressured from their partner. And so they give in out of guilt or obligation, but that leads to them, not really being able to be present or enjoy it. So they're resenting their partner afterwards. And it's really icky for both partners. That's just not the type of sex that either of them want to be having, but they are. And so that's another layer to it.
Yeah. Because I'm sure the partners are probably in the dark about what's going on as well, because no one has the vocabulary or ability to have the really tough conversations. And so there's just silence and barbs and, yeah, like you said, resentment. That's so... And all of that, just, if you're not having any positive experiences in between, it's just piling negative on negative on negative on negative.
Right. Yeah. And then the partner on the other end of it, they're thinking, I'm failing, what's wrong with me? Why can't I please them? All of their negative beliefs are coming up too. And so it can be pretty vicious to get stuck in that cycle.
So then do you do EMDR? I've only done it, as my own self. So do you do that with both partners at the same time?
So typically, no. I'll just work with one partner. If there's like sexual trauma or breaking like the anticipatory cycle of pain,
right,
or performance anxiety with penis owners. What I do with couples is, if they have these kinds of issues, like the pressure and the guilt and obligation, is I'll encourage them to take penetration off the table for a time being. And everybody's like, gasp, there are reactions to that, but it serves a purpose, because, we've got to break this cycle, and we've got to give, the partner that feels like they can't say no a minute to feel like they are in control of their bodily autonomy and to focus on other forms of intimacy. So have you heard of Sensate Focus?
No, tell us.
Okay. So there's 9 different phases, but it's a series of mindfulness touch exercises. And typically you can do it by yourself, but if you want to be, sexual in a relationship, eventually you're going to have to do it with a partner. So you start off by, you're each going to take turns. One person gets to be the toucher, the other one the receiver, and then you switch after like 10, 15 minutes, and you just experiment with different types of touch. And if your mind wanders, you're just going to bring it back to temperature. So is the skin hot or cold? Pressure. Is the touch light or firm? And then texture, is the skin rough or smooth? TPT is the acronym for it,
Okay.
if you want another fun acronym to remember. And that way it just creates, everybody gets to learn what their preferences are and just pay attention to what feels comfortable, what feels uncomfortable.
And you're really just trying to get into the sensuality of everything, where it's like, there's going to be no penetration. We don't even have to be concerned about that. Nobody's worried about your erection or how long it lasts. Nobody's worried about how tight or, your ability to receive. None of that.
Yep.
Mm-hmm.
Nope. You're touching for yourself, not for your partner.
Mm-hmm.
We're learning about your own preferences. And we're really slowing things down to, help the nervous system relax and not have any expectations when it comes to touch. And the first phase, breast, chest, genitals, and anus are off limits. So no erogenous zone. So it's really slow, gradual, and intentional.
Mm-hmm. Yeah, it was interesting. I did a goddess circle here in town, probably last year. And we were talking about how we were not valuing ourselves and speaking up for ourselves during sexual play, or frankly, professional or anything. Like we are just, basically you just deal with it, right? You just quietly deal with it, whatever it is, wherever you are. And I think, female folk do that far too often. And so we partnered up with the other women in the room, and we were just touching each other's hands and forearms and telling the other person, like, oh, I really liked that spot felt much better. If you could go back there, that would be nice. That was way too rough. Like, you're right on my bone and that hurts. And the silence in that room was deafening. It was awful. And then I think somebody kind of like snort giggled, and the rest of us started giggling because we were so uncomfortable. And it's like, we're not even doing anything sexual. Why is
I know. I feel like, at least where I come from, I have LDS Mormon background. That's how I was raised. We're taught, especially as women, that we need to be agreeable. And even if somebody is making you uncomfortable, you don't make them uncomfortable back. You don't let them know that, because, that's not what good girls or good women do. They just comply, which is icky, because, that's that whole culture is just rooted in sexual abuse of women and children. But, many people that come from Christian backgrounds have those experiences too.
Yeah, absolutely.
Mm-hmm.
Oh my gosh. Yeah, that was a long class, and we had a lot of talking and journaling to do, because it was like, we're a tiny little subset of people who have we have paid to be here to do these exercises, and we still can't get it done. And it's like, this couldn't be any more of a safe space, Like,
right. Yeah, and then if you do add any sexual trauma on there, that freeze, that fawn response can be even more just reinforced. Too, making it harder to speak up.
What's the fawn response? FAWN response?
So it's the people pleasing. So the example I give is, if somebody holds a gun to your head, you're going to do exactly what they tell you to avoid further harm, more violence coming upon you. It still is going to be bad, but you will probably be better off if you just comply. And that's, often what especially sexual violence survivors experience.
And we extrapolate that out into situations where that's not appropriate, right?
Right.
Yeah. Wow.
Sad.
Yeah.
That's sad.
I know. I think I do that too. Even as like sassy and mouthy as I am, I definitely do the same thing, because I figure I'd rather deal with the the fallout and the consequences afterwards than like make somebody uncomfortable or have an unpleasantry in the meantime, which is just terrible. Like, and I don't think most of the people that you're engaged with want that either. Like, they want the communication and the honesty and the feedback and all of that too. Like, so
I hope that's the people that your inner circle are those safe kinds of people.
Right. Yeah. It's just, it's so
if they're not, find a new inner circle.
Yeah.
Move on.
Somebody needs to go home.
Yeah.
Oh my gosh. Yeah. So you're doing a new certification through AASECT. Can you tell us about that?
Yeah, it's ASECT. So it's the American Association of Sexual Educators, Counselors, and Therapists. Total mouthful. But they are the credentialing board for sex therapists across the US. And their program is just absolutely wonderful. I've learned so much about, sexuality and our bodies. And it's actually been really healing for me to go through it.
Okay. Wonderful. So you're doing a little work on yourself too.
Yeah. I mean, you can't not going through it.
Yeah. I interviewed someone who was certified by them a couple months ago, Christina Sophie. And she's been doing this for probably 15 years or so. And it was just fascinating, like the things that she was talking about, like, well, I used to want to be thrown up against a wall, like the harder the better, be aggressive with me. And she's like, now I don't feel like that anymore. And so it's great because I can like understand both sides of that, like
totally
that really aggressive ferocity and power versus like, oh, just come over here and rub me and like make me feel good and all this
right really the fun. Sensuality. Yeah, there's no right, wrong, good or bad when it comes to sex or sexual preferences, as long as it's consensual and about mutual pleasure, mutual safety, mutual respect, and within your relationship agreements if you are in a relationship.
I had somebody ask me the other day what the difference is between sensualism and hedonism. I didn't really have a good answer for that.
I don't know if I have a good answer for that either.
No, it was an interesting question because I identify as a sensualist. And they were like, yeah, they're like, well, doesn't that just make you a hedonist? And I'm like, and then I read the definition. I'm like, I don't know. That sounds the same.
I don't really know either.
So interesting. There was a whole thing about labels the other day because I said online that I was heteroflexible, and there was some clapping back that, oh, you're just bisexual, but you don't want to own it. You're just playing with people and messing with their hearts and minds and all this other stuff. And I was like, what? I don't think that's what's happening.
Right.
And so I am so into labels because I feel very strongly that that's just the introductory of who you are. And then once again, we have to circle back to communication. Like, what does that label mean to you? Just because somebody identifies as something as simple as I'm a straight man, that does not necessarily tell you what their desires and expectations are.
Yeah, no.
Romantically. It's
no, not at all.
Right?
Yeah. I don't think it's toying with people, like, as long as it's communicated beforehand.
Right.
That's
kind of how I felt about it. I'm like, I don't think I'm making any women feel badly or confused or like.
Yeah. I mean, what does heteroflexible mean to you?
So my definition is I don't look to date women. I don't look to have a romantic relationship with them. But if we're in a situation where there's group play and they are bisexual or hetero-flexible and we're going to kiss and play with boobies and like stuff like that, then I'm here for it. But
that's exactly what I was thinking. Like,
So it was interesting that like there were several people who are like, oh, you're just bisexual and don't want to call yourself that. I'm like, no, I'm not. I actually wish I was bisexual. That would make things so much easier, honestly. Like if you were pansexual and you could just look at literally everyone around you with rose-colored glasses, why wouldn't you want to do that?
Yeah, absolutely. Agreed.
Yeah, I wish.
I'm attracted to people's personalities, or I'm comfortable with all genders. It would be so much easier for me than just men.
I know. Yeah, it's
so boring. So boring being straight.
Yeah, I know. You lose a little luster there if you're open-minded about it. And and I think I had to come across this for myself, in my 50s, for Pete's sake. So I probably missed out on a lot of opportunities before then. I'm just straight. I'm just a straight woman. Like, turns out somebody called it hard. Spaghetti. Spaghetti is straight until it gets hot and wet. Then
I love that. Oh my God. Yes. I can also definitely resonate and identify with that too.
I think it's so funny. That made me laugh real hard.
It's hysterical. Yeah, it's hard. It's hard when you're given like these rigid, narrow boxes that everybody has to fit in with sexuality. And that's ultimately not what sexuality is at all. It's very fluid and broad, and there's so much out there to explore. And people shouldn't be ashamed for exploring it lifelong and having that look different, when you're in your 20s versus when you're in your 30s, 40s, 50s. It's something that's going to evolve and change over time. And people should have fun with it, not, have to carry shame around with them.
Right. Yeah, I really do think my son's generation and probably the next one older, like mid-20s, they've done, it's a revolution. I think it's kind of quiet and not really spoken of very much, but their thought process and perception is so much more progressive than it has ever been, where they're just like, how do you identify? Who do you like to have sex with? Okay, there we go. Now we have a good idea. It's, it doesn't.
Wouldn't that be nice?
Right. And so they just do such a better job at communicating for themselves and with other people. And I think the open-mindedness and broad understanding that like gender and sexuality are two completely different things, and you can make decisions on that. And it might not even be the same every day.
Right. Yes. There's fluidity to it. Yeah. And I think the younger generations too are just more open to going to therapy, all those types of things that, might be contributing to why they're so, more comfortable with sexuality being broad and whatever works for you.
Yeah. When I had the conversation with my kid, he was 15 or 16 at that time, that I was polyamorous, and I was like, is that super weird for you? And he's like, Mama, it's so much weirder for you than it is for me. It's like, that's true.
All right then.
Wow.
It is a lot harder for me to accept that.
Right. Like, I'm still working on it. And you're all, yeah, whatever.
Whatever makes you happy. I love that response though. That's very sweet.
And that's actually what he said. He's like, he said, well, how are you doing with it? I said, sometimes it's a struggle, but most of the time it's fun and I'm learning a lot. He's like, okay, well, as long as you're being safe. I was like, isn't that what I'm supposed to be telling you? What's going on right here? Give me back those
Hey.
condoms.
For me.
Yeah.
Oh,
But I do just love that for them. But I mean,
too.
that aside, like we are still in a puritanical society and culture where
Yep.
the baseline is really clamped down and really narrow-minded, and
Yep. There's a lot of pushback, a lot of shaming, a lot of just inaccurate information out there when it comes to sex on so
do
many
you think
different
that's
levels.
worse with porn?
Worse because of porn?
Yeah.
I think, okay, I don't think porn's the problem. What I think the problem is that there is no standardized comprehensive sex education, and it is shameful and taboo. And so where do people go to get their information from? Again, porn, and even more so the media, because the media is in front of our faces all day, every day, movies, TV shows with, subtle messages and, images that kind of continue to perpetuate these harmful ideas about sex. And so, yeah, it's not porn that's the problem. It's because we're not talking about it. And then that's where they go to learn.
Right. Yeah. There is a OB-GYN that I interviewed a bunch of months back, and she actually does educational stuff on OnlyFans.
Really?
Yeah. And
I'm intrigued.
I'm not on OnlyFans, but just
No.
because of her, I'm like, I feel like I might have to. Is there like a 1-month sign up or something?
Yeah.
Do it.
What's her handle? What's her page? What?
I know, right?
I want to learn.
Shoot. I'm trying to think of what her name is. I can picture her right
Fascinating.
now. She's Your Girlfriend's Gyno is her general handle, or The Girlfriend's Gyno. And
awesome. It's giving me ideas.
She's fantastic. And yeah, when she said that, I'm like, oh my God, that's brilliant. Like, go to the source and have people stumble across you and then get the accurate information.
Yes, it's brilliant. That's absolutely brilliant.
Yeah. I mean, because how else do you break into that? Like, people aren't going to just be looking for actual boring information. Not that her stuff is boring, but if you're searching on OnlyFans and other porn sites, you're not like, oh, is there a physician on here that I can
I love that. That's awesome.
Yeah, I thought it was such a great idea. I might have to steal that.
Yeah. What am I doing wrong?
Apparently not getting that information out there the right way to the right people, but
it's like virtual sex surrogacy, maybe. Do you know what sex surrogacy is?
No.
Okay, so it's an actual profession where if you are someone who knows nothing about sex and has never had sex, or for whatever your reason is, they are allowed to work with you for 6 sessions, and they essentially teach you like how to have sex. And that includes oftentimes having sex with you, but it's done and over after 6 sessions. 6 sessions.
6 sex sessions.
Yes.
Tongue
twisters. Titty twisters.
Fascinating. So, I mean, that's nice, because then like, we are not having a relationship here. This is purely for educational purposes. And that's when this relationship ends. Fascinating.
Yeah.
Obviously.
There's a movie.
Go ahead.
There's a movie about it called The Sessions. I think it's Helen Hunt. Yeah, I think that's who's in it.
I love her. Fantastic.
Yeah, it's great. Yeah. So if you ever want to do a deep dive, watch that movie. It's fantastic.
And this is for any gender.
Yep. Any gender. Also, the TV show Virgins. Have you heard of that one?
I have.
Okay. I can't remember what it's streaming on, but there is a woman on there who has vaginismus, and her therapist encourages her to work with a sex surrogate to help her work through, that sexual avoidance towards sex that she has.
Fascinating.
Mm-hmm.
I mean, I feel like prostitutes have probably been doing this since
the beginning of
the
time.
Original profession, right? Like,
Yes.
it's the original
Yes.
Yeah, like they've been doing this the entire time.
The dawn of time. Mm-hmm.
Yes. And yet we cannot keep a male prostitute in work for anything. Like, Nevada has tried a couple different times to have a male prostitute, and there's all this press and everybody knows about it and everybody's watching like, oh my God, what's going to happen? And they don't even last like a year or two.
Sad.
I know, because when I heard about that, I was a little surprised. And then I was really surprised at, like, why not? This truly is a service to so many different people. Mm-hmm. And honestly, that could be a certain kind of sex surrogacy. Like, it's...
Yeah, absolutely.
You're going to somebody with experience and wisdom, and that can probably like really talk you through everything. Yeah.
And most of the people that I talk to that have sought out sex workers, regardless of your moral beliefs about them and, those who seek them out, they're typically trying to explore some type of fetish or kink that they've never, that's too vulnerable to like share with their partner, or, that they feel ashamed about, or they don't know how to go about navigating those conversations with an actual partner. Or maybe they've tried and they've been shamed about it. So that's why they turn to sex workers a lot of the time.
I would imagine people have a pretty positive experience with that, though, because they're going to people who are open-minded and who are not going to be judgmental, and who, like, if they have any experience with it, are probably happy to share that with them.
Right.
Why not?
Yeah. And, to be able to share like a part of yourself that you felt shame with someone is, of course, very like connective and bonding.
Mm-hmm.
So,
yeah. And maybe it can break down, those parts of you that you're giving yourself shade about it. And now somebody's like, yeah, I see you. And you're not the only one. You're not the only one today.
Right. Yes. Yes.
So let's talk about that.
Yes.
Yeah, it's almost like having your own little invisible community so that you don't have to feel alone with your thoughts and wonder if you're a total weirdo.
Right. Yeah. Per weirdo, all those things.
Yeah.
So
I love a good weirdo. I'm just so curious about
how much more fun.
Yeah. Like, and I've definitely learned, like, I don't have to understand it in my brain to just be okay with it. Like,
yes. You don't have to yuck somebody's yum. Like, you can just remain curious and open if your partner is sharing something, vulnerable with you about their sexual preferences. Doesn't mean you ever have to participate in it.
Correct.
But, trying to be open and curious is step one. And then there's, the negotiation, the navigation of, okay, well, is it possible for us to explore this?
Mm-hmm. And if not, like, is it possible for you to explore that with someone else? And
yes,
I'm okay with that.
Right.
That's really big, but being able to be that vulnerable and having that connectivity of like, this is almost our shared secret. That's really like, that's sticky, yummy glue there.
It's very erotic.
Yeah. So interesting. Oh, wow. That's really good stuff, Holly. You're
fun.
Yeah. Yeah. I think sex is such a fascinating topic because most of us want different things and we all experience it in different ways. And sometimes it's functional and sometimes it's not. And then you got to go back to the drawing board and figure that out.
Right.
Man, yeah. I was looking at a video today that was saying the clitoris is literally the one and only organ that humans have that is 100% for pleasure. It does not serve any other purpose whatsoever. And you think of like the penis, like, well, you pee through it. You have to have, I mean, you basically have to have that. You have to at least have the sphincter to go through. And so, but like, you don't need your clitoris for anything except joy and pleasure.
Oh, hell.
Right? You want clitoris. To know every little piece and nuance of that, and what she wants and what she likes and what is a no-no and what is a yes, please.
Yes.
Yeah. So I just thought that was so interesting. And the little, like this tiny little professor was talking about it in her little accent. She was just adorable and so passionate about it. And I was like, preach, girl.
Yes.
Yes. Tell all the teenage girls.
Yes. Shout it from, Right. Yes. I mean, teenage girls need to learn about their own anatomy and pleasure before they go out and start being sexual with others, so that they know what they like.
You know how to do your hair. Don't you want to know how to do yourself?
Right.
Like, this is all a learning process, and it should not be shameful. It should just be like, I own this elbow. I need to know how this thing works.
Yes. So, oh my God. Yeah.
Yeah. I know we're really far behind on that, but I think there's some inroads with the littles these days. I think they're doing a better job.
I agree with how widespread information is. Let's hope.
Yeah, the good stuff, not the weird, like, shameful, don't you do this, and people are watching you and you're going to hell and all that business. Like, no. If you've got it, understand it. It's yours.
Agreed. It's your body. You deserve all the pleasure that is within your own body. That's nobody else's to own or tell you what to do with it, but ourselves as an individual.
And then super fun to communicate that with people you want to share it with, because then they're like, what? Can I do that?
Yes. Sexual confidence is sexy.
Absolutely.
And consent is also sexy.
Yeah. Communication, confidence, competence. Yeah. The 3 C's. I'm already, Dr. C. I love my C's, so.
I have the clit in there as well. The clitoris. The 5 C's.
Oh my gosh. That should be a poster somewhere.
Yes.
Oh my goodness, Holly. This was such a joy. Thank you so much for joining us and educating us today.
Oh, thanks for having me. I had so much fun.
Yeah, maybe at some point I'll have to get you and India and me on there, and you guys can
what a riot that would be.
Right? I think that would be a blast, because you guys can do all sorts of, what did you see? What have you talked about? What do you do? What's your experience?
Yes, I'm down.
Super fun. Well, I'll see if I can gather us together with our busy selves. We'll figure out a schedule.
Yes, we will. Awesome. We will.
Okay. Thanks so much, Holly Nelson.
Okay. Thank you.
Right. Bye.